To, was this round 3 for House Appropriations? This is the Health and Human Resources Subcommittee, and we will take the roll. Okay, and we've got a quorum. We're going to go right into our bill list here, and we have Delegate Navarre with 1116 on page 8. We'll go right to that. Come on up.
Okay. I should have, first of all, thank you, Mr. Chair and members of the subcommittee. I should have an amendment in the nature of a substitute.
Move the sub or some more.
Move the substitute.
Second.
We have a motion to move the substitute's been properly seconded. All in favor say aye.
Aye.
Any opposed? No, that's before us.
Okay, I now ask that you adopt a line amendment to strike line 19 in its entirety.
Move the line amendment.
Second. We have a motion that's been properly seconded to move the line amendment. All in favor say aye. Any opposed? No. Okay.
Okay, so speaking to the bill as substitute and amendment for context, last fall, former Governor Youngkin issued an executive order aimed to ensure nursing homes meet the highest standards for safety, quality, and transparency. One of the directives was by mid-November, VDH had to create a new public nursing home information portal showing inspection and survey results, disciplinary actions, and key facility performance metrics. VDH met that directive. What I'd like to do is codify it and ensure it is more accessible from VDH's homepage. I have been in conversations with VDH. They've already started to modernize the portal and how inspection and enforcement information is presented to the public. I had originally wanted to see EMS reporting included, but because that would involve new reporting infrastructure and administrative oversight, I've removed it to bring down the implementation costs of this bill. I had also wanted to include DSS to have the same kind of information portal for assisted living facilities, but because that doesn't currently exist, I have removed that section to also bring down the fiscal impact. So my goal at this point is to codify the existing VDH nursing home information portal that was in the executive order so that information is readily available and easy for families to find good long-term care nursing facility for their loved ones. So what I believe is it brings the fiscal impact down significantly, and hopefully it is within VDH's ability to, so it's negligible, hopefully. So I ask for the committee to support this substitute.
Mr. Chairman, what is the fiscal impact?
Yes.
Mr. Chairman, the Health Department tells me that there's a fiscal impact of $140,000 each year and one position to manage the data on the portal.
Thank you.
Okay, Delegate Navarre, thank you so much. You're making great progress on this. You've definitely gotten the FIST down, and it's certainly a laudable idea. But I do think this year is tough. And so I think you understand that. But keep working.
All right.
Keep working on it.
All right, will do. Thank you so much.
Move to gently place HB 116 on the table.
We have a motion that's been properly seconded to lay HB 1116 on the table, and we'll go on the board. And that motion carries by a vote of 6-0. Thank you so much.
All right,
Delegate
thank you.
Navarre. Let's go to Delegate.
Anthony, she starts on page 2.
Okay, Delegate. Yeah, we've got Delegate Anthony on page 2. Come on up. Got a couple from you. Come on up.
Okay, I think we're going to address HB 610.
That'd be great.
Okay. So HB 610 is the Commonwealth Food Security and Coordination Act. We've had various conversations with Commissioner Storm, and from our meetings with the Commission to End Hunger and Department of Social Services presentations on the VINA program back in November, we found that Virginia needed to be ready for any type of benefit disruption in the future in case of federal fallout. And so this is the impetus of this piece of legislation. We wanted to establish a clear statewide framework to coordinate Virginia's emergency food response when household food access is disrupted. And we made sure that we just did not overlap what was already in EFSF 6 for emergency preparation when it comes to storms, And we found out that Virginia relies too heavily on improvised and temporary solutions. We don't want to start from scratch. This bill kind of helps and directs DSS, VDACS, and VDEM to coordinate rather than rebuilding the system during every time there is an emergency or there is a break in benefits. It does ensure emergency food distribution that can be activated within 24 to 72 hours. And what we found with the old VINA program was that the distribution of food was inequitable. But this uses a data-driven planning strategy to identify the needs and guardrails to prevent inequities, distribution, and resources. But also within the Commission to End Hunger, where it have instituted a Commonwealth-wide food mapping initiative. And so we have already begun that particular strategy, which could speak to House Bill 610. This does not replace the existing emergency frameworks, but we just wanted some transparency and accountability when it comes to any type of emergency services that have been disrupted.
Thank you, Delegate Anthony. Any questions for the patron? Thank you for that detailed explanation. We have a motion?
Move to gently lay 610 on the table.
We have a motion that's been properly seconded to lay HB 610 on the table. Go on the board. And that motion carries. Hit yours one more time. Let's see if it goes.
You're right.
Maybe sticking. There it goes. Okay. And that,
Thank you.
motion carries by a vote of 7-0. And Anthony, I think you've got one more for us.
I think from House Bill 1332, we have asked for that to be continued to 2027, and we already submitted a letter.
So moved.
We have a motion that's been properly seconded to continue House Bill 1332. That is a
Voice vote.
voice vote. All in favor, say aye.
Aye.
Any opposed? No. So that will carry over to 2027. Thank you so much.
Thank you. Appreciate you.
Appreciate that. Oh, you want to miss one
One
though?
more.
No, we've got one more.
So I think
wait.
I want to have House Bill 336 to be incorporated in House Bill 1398.
We have a motion that's been properly seconded to incorporate House Bill 336 into House Bill 1398, which we'll hear from in a minute. All in favor, say aye.
Aye.
Any opposed? No, we will do that. Great. Thank you very
Aye.
much. Appreciate it. Okay.
Mr. Chairman, she's going to be down in committee, so she's asked that I present her bills.
All right.
Oh, okay.
Mr. Chairman, House Bill 1398 is Delegate Franklin's bill that was just referred to by Delegate Anthony. And so I think do we need a motion on this one to incorporate that into this bill? We already,
Move to
you already did
incorporate
that.
338 into 1398.
We have a motion that's been properly seconded to incorporate House Bill 330, actually it's 330.
336.
336
Sorry,
into
typo there.
1398. We got a lot of bills. All in favor, say aye.
Aye.
Any opposed? No, because that's been incorporated.
And Mr. Chairman, there is a substitute on this, which would define fetal death as it's described in the code, in which the state registrar is required to issue a certificate of birth resulting in stillbirth. And there is language which focuses the team's review on natural infant deaths. And it did bring the fiscal impact down considerably from the original bill. And it's about $800,000 and some change each year over the biennium.
Okay.
Second.
We have a motion that's been properly seconded to move the substitute. All in favor, say aye.
Aye.
Any opposed? Okay, that is before us. Any questions from the committee?
Move to report the substitute.
Second.
We have a motion that's been properly seconded to report with substitute HB 1398. Go on the board. Motion carries by a vote of 7-0.
Mr. Chairman, the next bill, House Bill 1403, this again is Delegate Franklin's bill. It establishes the Severe Maternal Morbidity Surveillance and Review Program within the Department of Health to ensure that instances of severe maternal morbidity are analyzed in a systematic way. There is a substitute.
Move the substitute.
Second.
We have a motion that's been properly seconded to move the substitute. All in favor, say aye.
Aye.
Any opposed? No. Okay, that's before
Mr.
us.
Chairman, the House substitute just removes the third enactment clause. This is the clause, as we describe it, that
Yeah.
the Senate typically puts on their bills.
Okay.
And,
I move we.
I just did recognize that we have the patron here, but I think you're making great progress. So we'll keep rolling. Okay, thank you very much. Okay.
Move that we pass 1403 as substituted.
We have a motion that's been properly seconded to report with substitute HB 1403, and we'll go on the board. And by a vote of 7-0, that motion carries. Delegate Franklin, your mere presence has helped your bills to pass. So there, there we go. Okay, thank you.
We have delegates.
I mean, that's
We have Delegate
Glass.
Carroll and Delegate Glass, and Delegate Carroll's been sitting there for a while.
Let's get Delegate Carroll. And that is, come on up. Next, we're going to move to HB 1297 from Delegate Carroll. Thank you for joining us.
Yes, good afternoon, Mr. Chair, members of the committee. HB 1297 is simple, an adult protective services registry. We do it for our children. We do not do it for our adults. We know without question there's been an increase of various adults, whether it be our aging population or our ID community, that just need some assistance. I can tell you from the personal experiences as a caretaker, when I go out and want to find someone to step in while I'm right here, currently now here in Richmond, serving my thing. I have family members that are back home that I need to have them care for. I would love a place for me to be able to go and be able to research somebody's background to ensure that they have not been founded of having to abuse this specific population while the persons that care for them have to go out and make a job. I know there's a significant fist that's associated with this, but I would infer to the committee to ensure that we be reminded that this creates that central repository for people that have found it to have created various or been various points of abuse and or neglect to our specific population, that there's a place that we can go actually see and confirm that prior to hire.
Thank you so much, Delegate Carroll. Any questions for the patron? Really appreciate you bringing this forward to us. Otherwise, I will entertain a motion.
Move to gently place this bill on the table due to the fiscal impact.
Okay. We have a motion that's been properly seconded to gently lay on the table HB 1297. Go on the board. And that motion carries by a vote of 7-0. Thank you so much, though, for bringing that to us.
Thank you so much, Mr.
Appreciate
Chair.
that.
Next bill is 578 on 7.
Yes, we've got, I almost missed her over there, even though she's got a very bright color on, but we have Delegate Glass. She's got to come up.
Gratitude to Mr. Chair. I have House Bill 578.
578, come on up. Yes, thank you. Go ahead, yeah, please proceed.
Copy,
Go
I was
ahead.
just making
Thank-
sure. So
Yeah, thank you.
the Commonwealth of Virginia, we are currently taking over $3 million from children that belongs to them and was children in foster care. The state actually applies for benefits on behalf of children and then uses that for their own care, and then sends them off after the age of 18 out into the world without funding for housing, for schools, or anything like this. What the bill requires is local departments of social services to continue their screening of the foster care children eligibility for those federal benefits, including Social Security and VA benefits, and apply those benefits to a form of trust on their behalf. It also limits when local departments can serve, when they may serve as a representative or a payee, and ensures that the benefits are solely used for the child's individual needs. We are not doing this for children who don't collect those benefits. So essentially, we are taking over $3 million from foster care kids and putting them out into the world with nothing. And that's what this bill hopes to do.
Delegate Glass, thank you so much for bringing this. It's a super important issue, and I know there are multiple efforts looking at our foster, how we take care of our foster kids, and this certainly sounds like another area to address. There's still an impact, though, and I think that may be the challenge we're facing here. So I'll take a motion.
Mr. Chairman, I move to place HB 578 gently on the table.
We have a motion that's been properly seconded to gently lay on the table HB 578. We'll go on the board. And that motion carries by a vote of 7-0. Again, thank you so much.
Gratitude, Chair and committee. Appreciate you.
She's right down here.
We've got Karen. Delegate Keys Kamara, come on up. And then we'll get to Delegate Levere Bowling.
Thank you.
Yeah. I'm sorry. Please go ahead.
This is HB 76, and this bill aims to improve the foster care system by ensuring that children who travel into the foster care system do not have their belongings placed in a trash bag. That's the essential problem we're trying to correct. Now, this bill was looked at in previous years. Each year, it has a significant financial impact. This year, I had an opportunity to work with the department, and based on their report, a few things are happening, and so this has been scaled down to a pilot, which we have requested in writing, and I'm not sure that it's come from DLS yet or not. But it basically, what is happening is two things. One, the department is already working on this issue, and they're working with nonprofit organizations as well as using their current funds to try to eliminate this problem. So what has been requested of me from the representative, and I'm sorry, so sorry, I forget his name, that represents the department, is he suggested that we turn this into a pilot for about $200,000 that would allow them to continue this process, assess how great the need is, and be able to report exactly what the additional need could be, but he believes that they would be able to address a great deal with this small amount so that we don't have the great impact, but we can continue to work on this significant issue. And I hope that it is the will of the body to support, to report this issue, this particular bill.
Thank you so much for bringing this to us. Any questions from the committee? Any motions from the committee?
Mr. Chairman, I move to lay HB 76 very gently on the table.
Do we have a second? We have a motion that's been properly seconded to gently lay on the table HB 76, and we'll go on the board. And that motion carries by a vote of 7-0. Delegate Keys Kamara, thank you so much for coming up, though. Okay. Now, we have Delegate Levere Bowling with several things for us.
She's got, starts on page 6.
We'll start on page 6.
Yeah, 435.
With
425 and 435.
Let's do HB 425.
Beautiful. Thank you, Mr. Chair, members of the committee. 425 expands access to maternal health services by strengthening Medicaid coverage for remote patient monitoring during pregnancy and postpartum period. Members may recall that we had similar legislation last year, and the bill before you today is a bit different because it significantly narrows eligibility and improves cost efficiency while preserving strong clinical impact. We are expecting a new FIS to come out that is much, much smaller because of the narrowed language, but we have not seen that posted yet. The current law guarantees coverage only for certain high-risk cases, but this bill clarifies coverage for high-risk pregnancies and individuals of advanced maternal age, defined as 35 and older, and it extends monitoring through 12 months postpartum, aligning with existing Medicaid coverage. And with that, I'll stop and yield to the committee.
Thank you, Delegate Levere Bowling. And most importantly, you did not call that a geriatric pregnancy.
I know, I didn't this time, I didn't.
Yeah, that was getting personal for a lot of people. So, sorry, I had to say that. We do have an updated FIS, though.
Oh, wonderful. That's good to know.
Susan on that one.
Mr. Chairman, the updated FIS is about $326,891 general fund to be matched with non-general fund in the Medicaid program, and that's in the first year, and $375,134 general fund in the second year to be matched with Medicaid dollars.
That's great. And this was, as you mentioned, still related to the Omnibus.
Correct.
From
Yes,
last year.
sir.
Okay, very good. Any questions for the patron? Do we have a motion?
Move that we report HB 425.
With
We say the substitute from
No,
the,
you don't have.
we don't have
We'll have to do
that now. So the motion has been properly seconded to report HB 425, and we'll go on the board. The motion carries by a vote of 7-0, and we'll go right to HB 435.
Beautiful. Thank you, Mr. Chair and members of the subcommittee. I do have a substitute for HB 435. It is it's a simple language change that we actually thought we did in the previous committee, but we neglected to do so. And so if we could
Move the substitute.
that. Thank you.
We have a motion that's been properly seconded to move the substitute for 435. All in favor, say aye. Any opposed? No, that's before us.
Thank you, Mr. Chair. The substitute simply cross-references the existing code definition of palliative care rather than creating a new one, ensuring consistency and avoiding any statutory duplication. But HB 435 establishes a statewide palliative care consumer and professional education and information program. It also creates palliative care and quality of life advisory council. The goal is to simply improve awareness, coordination, and access to palliative care for Virginians facing serious or chronic illness. Evidence shows that palliative care improves quality of life and reduces avoidable hospital use, yet access and awareness, especially in rural areas, remain uneven. The bill directs the Department of Health to provide up-to-date resources and provider education, and creates an expert advisory council to identify the gaps and recommend improvements without creating treatment mandates. And with that, Mr. Chair, I yield back to the committee.
Now, again, thank you so much for bringing this to us. Do we have any questions from the committee?
We need to talk about budgetary, Mr. Chairman, budgetary impact.
Yeah, which I believe I may defer to Susan on that. This is on 435.
Yes, there is a fiscal impact to the Department of Medical Assistance Services. It's about $570,000 and some change, and that's for a vendor to develop the licensing and the benefits scheme. And then a continuing cost of $120,000 for a position, and then $50,000 for a one-time campaign in the health department.
Mr. Chairman.
Thank you. Yes.
Unfortunately, I moved to table, put 435 very gently on the table.
Do we have a second? Or a second. Okay, we have a motion that's been properly seconded to gently lay on the table HB 435. Go on the board. And that motion carries by a vote of 7-0. Delegate Olivia Boland, thank you so much.
Thank you so much.
Okay. Now, let's see what we're going to look through our list. Did we do?
Oh, you didn't know? Yeah.
Let's go. We're going to go back to page 1. I've got a couple more bills to get through, including HB 328. Delegate Sullivan.
Mr. Chairman, I'll handle that for Delegate Sullivan. That's 32028, and that is coming from the HERC. And it essentially tells the Bureau of Insurance to select a new essential health benefits plan with those 7 items that are listed on the page there. That would be new. That can be accommodated in with what the actuarial analysis said we could cover coming into the next plan. So that would be something that you could.
Mr. Chairman, move to report 328.
We have a motion that's been properly seconded to report HB 328. We'll go on the board. And that motion carries by a vote of 7-0.
You do have Delegate McLaughlin's bill on page 5.
Let's go to page 5. We've got H.
Oh, you want to go ahead? Okay.
She's right there.
So this would direct, Mr. Chairman, this would direct the State Board of Health to adopt regulations to use point of use or point of entry drinking water treatment or filtration systems to remove concentrations of PFAS and other established and emerging contaminants. The bill would specify the total cost of operating the program would not exceed $3 million. So there was no formal fiscal impact statement on it, but the health department tells me it would be anywhere from however much the General Assembly appropriated up to $3 million.
Thank you.
Mr. Chair.
Yes.
Move to place 348 very gently on the table.
Do we have a second?
Second.
We have a motion that's been properly seconded to gently lay on the table HB 348. Go on the board. And that motion carries by a vote of 5-2. And we'll go to HB 358.
Yes, Mr.
From
Chairman.
From Delegate Helmer, yes.
This one amends provisions related to the State Corporations Commission's issuance of regulations to establish minimum standards regarding Medicare supplemental policies to include minimum standards for risk adjustment. The SCC can absorb the cost within their existing budget, and that would be to contract with a consultant to help with the risk adjustment component and the report.
Okay, any questions from the committee?
Mr. Chairman,
Yes.
I move to report 358.
We have a motion, it's been properly seconded to report HB 358. We'll go on the board. And HB 358 reports by a vote of 6-0. And just me? Or else?
Yes, we've got Delegate Hayes' bill too.
Okay.
Do you have a preference?
We did.
No, we didn't.
Let's go to the top of page 8. We've got HB 838 from Delegate McClure.
Mr. Chairman?
Yes.
House Bill 838 just pertains to Medicaid and the doula care that's provided through Medicaid. It essentially codifies what is in the existing Appropriation Act, so there's minimal impact to DMAS.
Move to report H38. 838.
We have a motion that's been properly seconded to report HB 838. Go on the board. Motion carries by a vote of 7-0. All right, now, I'm just going to keep down the page. We've got, I'm going to turn this over to the vice chair for my HB 1240.
Chairman Willett, you tell us about HB 1240 and why we need it.
Madam Chair, thank you so much. Just very briefly, this bill would direct the substitute. Oh, actually, there's a substitute. Oh, there is I need to have the substitute moved. I apologize.
All in favor of the substitute?
No, that came up from HHS.
It came from HHS, so we do
Okay.
have it. I apologize. So we do have that before us. I'll go back to the bill then. The issue we're having right now is folks who are applying for Medicaid, when they're denied, they do not always know that in a timely manner because of delays in the mail and whatnot. So this bill essentially creates a longer time period for which in which they may reply. It's up to 90 days. I do understand that there is a cost impact because, yes, there would be more appeals filed, and we may not have the money this year to accommodate this, but it is an important issue, particularly as we get into the issues we're going to be dealing with Medicaid and eligibility. I know there are other provisions in the budget that are going to hopefully help our agencies deal with that because they've got a big burden coming to them. So with
Madam
that,
Chair, I have a motion to table, to gently lay this bill on the table. We need to go to the board.
Go to the board. Delegate Willett, your bill is gently laid on the table, 6-1.
Madam Chair, thank you so much. We're going to go to 13, yes, the top of the page, 10, we've got HB 1380 from Delegate Siebold. I think Amy's going to cover that
Yes,
one.
Mr. Chairman, HB 1380 by Delegate Siebold would adopt regulations requiring service providers for individuals with developmental disabilities to conduct regular emergency medical drills. This would also require DBHDS to impose sanctions on providers who don't comply. This would have a cost to DBHDS to hire 3 additional positions, costing a little over $663,000 general fund.
Thank you. I just wanted to make one note on that. Again, this is for another day to run this down, but it did seem like the number of sanctions they were going to have to impose was that number seemed very high to me, and I think that's others had asked that same question. That's an issue for another day that we can look at because there's obviously a fiscal impact here at any level that's significant. So just wanted to flag that. And if there are no other questions, we'll take a motion.
Mr. Chairman, move to gently table 1380.
Second. We have a motion that's been properly seconded to gently lay on the table HB 1380. Go on the board. And that motion carries by a vote of 7-0. We've got Delegate Hayes with HB 1391 for us. And this does have and this has a substitute, if I understand correctly.
Yes.
Move the substitute.
We have motions and properly seconded to remove the substitute for 1391. All in favor, say aye. Aye. Any opposed, no. We have that before us. Thank you, Delegate Hayes. Oh, you can cover, yeah, we'll go to the summary here.
The substitute would modify the availability of telehealth coverage to make it available for an extended coverage instead of implying that it would be 24/7. That would be up to the work group that's in the second enactment clause to consider and make recommendations on December 26th. It delays the provisions of the first enactment until July 1, 2027, so that the
Mr. Chairman, move
recommendations
to
can be
report
received.
as substituted.
We have a motion that's been properly seconded to report with substitute HB 1391. We'll go on the board. Oh. There it goes. And that carries, motion carries by a vote of 7-0. And,
Mr. Chairman?
yes, last but not least, HB 1418 from Delegate McQuinn.
Yes, this directs the Department of Health to establish a sickle cell trait awareness and education program. The fiscal impact is a little over $380,000 the first year and a little over $370,000 the second year.
Thank you.
Move to report.
We have a motion that's been properly seconded to report HB 1418. We'll go on the board. And that motion carries by a vote of 7-0. We're going to take 2 seconds to make sure I didn't miss one. I think we got
them all.
Okay.
Yep.
I think we are good. Ladies and gentlemen, thank you so much. We are adjourned.